Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, listeners. I'm super excited because this is a first for me as a host on the Prospective Doctor. This is my second part of a series by Dr. Carolee Estelle. We had her on last week's episode discussing her journey to medicine, where she currently works as an infectious disease specialist and epidemiologist. If you haven't heard that episode, stop this one and go and check that out and then come right back to us. But for the listeners who didn't hear that introduction, I'll have her give another short intro now.
Hi, Dr. DeRouen. Thank you so much for having me again. It's really an honor and pleasure to get to talk with your audience. So I'm Dr. Carolee Estelle. I'm a physician. It specializes in infectious diseases and in healthcare epidemiology or infection prevention in Dallas, Texas at UT Southwestern Medical Center and at Parkland Health Hospital Systems, which is one of the largest safety net hospitals in the country. And I got to serve as the healthcare epidemiologist during our COVID pandemic response. And so have spent a lot of time working on that.
Thank you for that. I will say that we did discuss about how the pandemic has definitely changed and highlighted the field of infectious disease and epidemiology. For the listeners out there, I would love to hear your perspective on how the COVID pandemic has impacted medicine in general.
Yeah, so the pandemic has, of course, had a significant impact on every aspect of our lives, and particularly in the healthcare setting where our healthcare workers have been on the front lines, putting themselves at risk in general, but in bearing the brunt of taking care of those who have become ill with this infection. It has changed our healthcare systems, in some ways transiently and in some ways permanently. On a more transient basis, we had to transform our physical locations and the way that we deliver care. I know at our organization, we turned our entire operating room suites into a COVID dedicated care unit. So it changed the way that we deliver care as a whole. Now, with fewer cases, as cases decline, we no longer have to do that and care for them in traditional patient rooms. But there are aspects of our approach to care that have been changed, and telemedicine has been employed and will likely continue to be employed very heavily. And so I think that some things have come to stay.
Absolutely. There have been a lot of changes. Some of them have actually been positive in medicine in terms of us investigating and changing our policies for the way that we see patients, opening up telehealth practices, allowing for there to be more cleanliness in the hospitals to kind of avoid the spread of infection, which I know is your special arena.
Yep.
So some things have been positive. And now we actually have the vaccine. So there's been a lot of discussions about the vaccine, and it has definitely helped us globally actually decrease the amount of cases as well as the amount of deaths. And as the world is starting to open up a little more, we want to just kind of take a dive and just talk about how you think that the vaccine is doing and what types of issues are popping up with it.
Yeah, that's a really good question. So we, as a country, so I'll focus on the U.S. So far, as of about a week ago or a couple days ago, just since the listeners will be listening to this at various times. In June, we're at about 45% of the U.S. population is fully vaccinated, which is not where we want to be, but is also an accomplishment that we really should be proud of. What is important to also note is that that's variable. When we take a look at some states, they have been able to reach 70 and in some cases 80% vaccination rates. Mm-hmm. And others are as low as are in the 40s. And so it's very variable. And then even when you look down into those states that are in that 70%, 80% fully vaccinated category, if you look and break down the different areas and regions of those states and those cities, there are pockets that have very low vaccination rates. And so some of that comes down to part of, and when we look at it, it's a lot of access, and our marginalized communities are the ones who are still at risk of COVID from these vaccines not being rolled out as ubiquitously there. And that's multifactorial, right? So some of it is, did those municipalities, were they able to get vaccine into those areas as effectively as they wanted to? And how much hesitancy, how much concerns did people have? Hesitancy is a very, I actually really like to call it lack of confidence. People are just less confident in or unsure about the vaccines. And it's really important to note that that's okay for people to feel unsure and less confident about these. And we don't want to ridicule people for those feelings. We want to help get them quality information and find out what their concerns are. So I spend a lot of time in my community actually talking to different groups and areas and communities about what are their questions, what are their concerns. And we know that our country has a history of transgressing certain populations, Black populations being one of them, immigrant populations being others. And so these groups who have a generational history and memory of things being done wrong to them, it is difficult to earn trust back from that. And so it's not something that can be fixed overnight, and it's not something that can be fixed in one conversation. But as we talk about what are the concerns and slowly address them, it can help.
I love that response because you're correct. There are so many different issues going on in the community, and we can't just point it to one reason. There may be listeners out there who may be wondering, like, oh my goodness, is she having another COVID vaccine episode? Yes. Because as the time evolves, different things and different factors change the reason why there is hesitancy or inquisitiveness or wanting to learn more information about the vaccine before they accept it. And like you said, every state is different, every locale is different, every person is different. So there are some states like New York and other states where they have reached 70, 80% vaccination status and things are getting back to normal. And there have been very low transmission rates of COVID. And then there are other states where vaccination is on the lower end and they may have growing viruses or they may be feeling some of the effects of what they call herd immunity growing and things like that from the other vaccinated people in our populations. And even with that, there may be different sides as to why people choose not to vaccinate at this point. That does not mean that they won't vaccinate in the future, but at this point in time, there may be reasons that they're not comfortable. Mm-hmm. And even in certain communities, I know that you mentioned communities of color. Yes, there is definitely a strong, rich history of marginalization and experimentation on specifically Black people, Indigenous people, and others. And that may be reasons why people are choosing not to vaccinate at this point. But if you were in a patient room and you had a person of color there, I would definitely urge you not to assume always discuss and ask questions as to why that particular person is feeling uncomfortable, because it's always a moment of education where you may have that opportunity to impact that person and kind of ease their concerns.
Yeah, I totally agree with you. And that's one of the beautiful things about being a physician and doing what I do, is that we get to be there for people when they are having questions and making these decisions. And one of the most important things we can do is to listen and explore where they're at, right? And go from there, and whatever that need is, because every individual is different. Everybody has a different story, any kind of different backgrounds, even physicians have different thoughts on these things and concerns and fears, and everybody deserves the opportunity to have those questions answered. And then, even you guys, listeners, who you're in your pre-med or you're in med school now, you still have the opportunity to be informed about this. But when people open up to you about it, explore where are they coming from, find out more about them, and what's important to them. It's not just, what's wrong with you, go do this type of a thing. So I think I really like your thoughts on that.
Thank you. I definitely think it's an important conversation that we'll continue to have over time, because although the virus has definitely decreased in transmission and in severe cases, at this point in time, I think we're going to be dealing with it for a while. So we'll have a lot more to learn as things evolve, and they've been evolving throughout the year. Now, we've definitely hit on some of the reasons why there may be some hesitancy. We talked about healthcare disparities and distrust. We specifically hit on the distrust of certain communities in terms of just the healthcare system in general. But what we haven't chatted about is some of the distrust of the vaccine in terms of its potential adverse effects or allergies and different things like that. Do you have any thoughts on that?
Yeah, there are some pretty common questions that people have. One of them being, how did we do this so fast? The other one being, how do we know this really works? Do these studies involve, who do these studies involve, and why can we trust them? And then are they safe? That other question that you're asking. And my typical response to the first about, how did we do this so fast is, we actually didn't do this as quickly as you might think. The first SARS outbreak that, has been sort of documented and recorded was in 2002, 2003. And then again in the 2012-13 timeframe, MERS-CoV. And then again now. So scientists have been studying these novel coronaviruses for decades. On top of that, they've been working on vaccines for them for a very long time. The messenger RNA technique that's been sort of really the big moment of excitement for this pandemic and the vaccine rollout, that technology has been studied and worked on for a decade or so, and actually being used in other ways, just not very commonly or prominently. And then the adenoviral vector vaccine technique has been in play since like the late 70s, early 80s. So they're not as new as you might think. And then they used a strategy A. All the scientists focused on this. The government threw all of their money at it in terms of funding the research to do this and funding the clinical trials and all of that. Typically, it's actually a lot harder to get funding for these sorts of things. That helps. And then they lined up the studies and the phases to be occurring on top of one another so that they could get through this quickly. Manufacturing and the like started immediately. And then, the clinical trials. So people are also unsure how, you said that this was going to take us 5 years. How did we get this done so quickly from the clinical trial aspect as well? And one thing that I think is really important to note is that typically it takes a long time to actually enroll all these thousands of people. But with COVID, a lot of people were knocking down doors to become a part of this because they wanted to help be part of the solution. So we have 3 studies, all that had 30,000 or more volunteers, that all filled these studies really, really quickly. That typically won't happen so quickly. And then once they've got all of them enrolled, then we can get that data pretty quickly. And they did a phenomenal job, or they did a good job at minimum, of really trying to be as inclusive as possible. They had task forces for each of the clinical trials that were specifically dedicated to ensuring that they were inclusive based on race, ethnicity, age, and medical conditions. And so that was a high priority, and they did succeed. Typically, we see about 2 to 3% non-white sort of involvement in these clinical trials for vaccines. And they had, in the high teens, 17, 18%, and upwards of 40% in the J&J trials. So they really were inclusive, which I think is important and something to applaud.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
I appreciate that deep dive into the information, because I think that it will help a lot of people. So especially listeners out there, you guys are at an advantage because we're living in a time where there's so much information happening in real time. So you kind of get to learn about how the actual scientific method works. And we're living in a time where things are just growing, and there hasn't been a time like this since, I don't think, the HIV epidemic, where new medications and vaccines and stuff are coming out. And I think that this will be something that you guys will be telling your students in the future. And for the listeners out there who may be hesitant themselves or have family members, is something that you can allow them to listen to and maybe take a deeper, closer look at the actual studies to read. But what I think that Carolee is saying is that it may have seemed rapid, but we actually had an advantage with this not being the first coronavirus that we've seen. So we've had years to study this, and we've had years to study SARS. And on top of that, we had an abundance of resources. We were basically throwing money to figure out how we can help everyone at this. And when you have more money, you have more resources. We had more volunteers to work into the trials. So we actually had all of the things that we would have had over these years that you would assume that most trials take. But because we had more resources, we were able to accomplish what we needed to do in an appropriate amount of time.
Exactly.
How do you think, from the numbers we talked about, that a lot of the new transmission rates are coming down and people are able to be more protected with the vaccine? And now in the news, we're seeing more instances of the new variants popping up. How do you think that will affect the currently vaccinated people?
Yeah, so that's a great question. So in terms of the variants, so first, just to kind of cover what are we really talking about when we talk about variants, and why do we talk about them? So there are hundreds of thousands, if not millions, of variants of of COVID that are of the SARS-CoV-2 virus that already exists. These are RNA viruses. They replicate very, 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 very quickly, and their proofreading machinery that prevents mutations or little errors is not quite as sophisticated as ours, I would say. And so they commonly will have these little mutations that occur and may continue on. And occasionally those mutations will change the behavior of the virus. Most of the time, actually, those mutations will make it less effective. It'll just die off and we won't really care about it. But occasionally those mutations cause a change that makes it either spread more efficiently or harm people, cause more severe illness, or gets around our vaccines and our treatments. And so the variants of concern are the variants that fall into that category, into one of those three categories. And so you heard a lot of talk about the B117 variant, now known as Alpha variant, and now you're hearing more and more about the Delta variant, formerly known as B16172. And so what's important about those is the Delta variant, it spreads much more efficiently. It's much more infectious. It spreads about 40 to 60% more efficiently, or spreads as that much more transmissible than the Alpha variant. And the Alpha variant was already 40 to 70% more transmissible than the wild type, which was kind of the original COVID. And the other issue with Delta is that it's looking like people are getting more severe illness at earlier stages, at days 3 and 4 of symptoms instead of days 10 and 11 and 12. Mm-hmm. And there is some reduced efficacy of the vaccines, although still high levels of efficacy when we talk about that against both of these variants. So the folks who are at most risk for these new variants of concern that are currently circulating, and Delta variant is expected to become the predominant variant in the U.S. pretty quickly, currently with a doubling rate of every 2 weeks, they're most at risk are the people who are unvaccinated. And that's because, again, the current vaccines still appear to be pretty effective against it. And so those who are most at risk are those who are unvaccinated. So the communities who have lower levels of vaccination rates are going to be the communities that are more at risk of getting one of these, of this variant that's spreading more quickly and causing what we think is more severe disease.
Thank you for that overview. And I think that really hits home that we really have to continue to push to encourage everyone to be vaccinated. And I think that will be something that can really help us in the future.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, we'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Yeah, I think. And so that's really a plea for, if you haven't been vaccinated yet, please consider it. Talk to your doctor, talk to your provider, talk to friends and family that who've gotten it, and find out, what their experience was, why they decided. And then also, sites like CDC, are really helpful and have lots of really good information to answer questions.
Thank you. You bring up great resources for people to look into information. I will also highlight that there's a phenomenal site called Greater Than COVID that dives a little more deeply into some of the questions that people may have if you're a little inquisitive about the vaccine or side effects or the state that we're in. As we all know that each week is different and everything is evolving, and although outside is opening up, we still have to realize that the COVID pandemic is not over. So remaining cautious.
Yeah, and that's a good point. And, the vaccines are highly efficacious. We know that, at least, and based on breakthrough cases, in terms of breakthrough infections are basically any positive COVID test that's more than 14 days after finishing a full vaccine regimen. And those rates, at least as of the beginning of June, are less than 0.002% of vaccinated individuals getting, breakthrough infections that lead to hospitalization or death. And so that is really encouraging that those rates continue to be very, very low in spite of the proliferation of these variants. And that should provide us comfort and reassurance. But it also is a signal of, hey, listen, these vaccines, even though they are highly efficacious, they're not perfect. And so if you are an individual who either is high risk in that you have, immunocompromised status or a lot of medical comorbidities, or you're living with someone with those, please still exercise caution. And and for anybody who's going to mass gatherings, please consider still using some caution, because we're not out of the woods yet, although we're doing really good. We're doing much, 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 much better. We're not totally out of the woods yet. So we want to still use some caution. And for anybody who's not fully vaccinated, please continue to protect yourself and your family members by distancing, keeping good hand hygiene, and wearing a mask.
Thank you so much. I think that all of our audience members at least learned one thing today. I know that I did. And we really appreciate you for taking part in this 2-part series. For all of the listeners out there, definitely go back and listen to the previous episode with Dr. Carolee Estelle. And hopefully we'll have her back in the future. I'll give her an opportunity to tell us goodbye.
Well, thank you again so much for having me. And I just want to wish all of your listeners the best of luck in all of their future endeavors and goal seeking.
Thank you so much. And for all of the listeners out there, click that subscribe button. And I'll be back again next week with another guest. See you later.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.